Hi, I'm DJ Kedar, respiratory clinical pharmacist. As many people think, smoking is not only a routine or habit, it's an addiction, some illegal drugs. So what's in a cigarette make people addict? Cigarette has tobacco leaves. When it gets burns, it releases various chemicals. It releases something called nicotine as well as 5,000 more chemicals. The nicotine is harmless but very addictive. Whereas the chemicals, which inclusive of ammonia, arsenic, cyanide, carbon monoxide, many more poisonous chemicals in them, also 70 of them can give you cancer. Some people say, cigarette relax me, reduce my stress. Actually, cigarette reduces your nicotine stress, not the real stress. It put more physical stress on your body. By quitting smoking or stopping smoking, you can improve your mental health well-being, which means you can reduce your stress, anxiety, as well as depression. There are 47,000 cases of lung cancers in the UK every year, and 75% of them caused by smoking. Smoking can affect you top to bottom of the body. By quitting smoking, you can see things clearly, start hear things clearly, your smells can better, your skin can come back to normal, you reduce your heart risk, as well as massive changes in your lungs. You can start breathing better, your exercise tolerance can improve, which means you can walk easier or do your household activities as what you used to do, and you can cough can improve, you can bring your mucus easily from your lungs so that you can have a clean lungs. Also, for respiratory patients, we're looking for no chest infections or no hospital admissions due to chest infections. By quitting smoking, you can avoid all your chest infections. Overall, you feel more healthier and you save money. Do you want to give up smoking? Then you need to do 3 steps. Step number 1, you need to prepare yourself to make changes. What changes I'm talking about? The changes to break your routine, break your habit, and just avoid all the triggers. Step number 2, choose the right smoking products which is working for you. The famous ones are nicotine replacement therapies. As I mentioned earlier, nicotine is a harmless chemical. So we can give you the nicotine replacement therapies which have nicotine to you and avoid all 5,000 chemicals. It's available as patches, chewing gum, lozenges, spray, mouth spray, nasal spray, inhalator, in many other combinations. Having combinations nicotine therapy, which means a patch as well as one more product, will make you success to quit. It's available over the counter as well as on prescription. The second product is Varniclin, or Champix we call, and this works on your brain nicotine receptor and it stops your craving and withdrawal. And it also makes smoking is less enjoyable, so it's one of the best options to try as well. And this is available on prescription. The other drug called Zybon, that also stops your craving and withdrawal, available on prescription. And some people go for cold turkey, like drink a glass of water and willpower. That's fine. The step number 3, you got the smoking products and you got a behavioral support from a stop smoking service. Combine them to get the maximum benefit out of it. The smoking champions can follow up with you weekly basis, and then they can support you for 12 to 16 weeks. Agree a quit date with them and start your journey. Some people say, I have smoked for many years, over 40 years. What's the point of quitting smoking? I would say there are 2 benefits to your lungs. Number 1, you prevent further damages to your lungs. Number 2, you're giving a chances to your lungs to repair the damages caused by smoking. Isn't it good? To conclude this, I would like to tell you the truth. 53% of the ex-smokers said quitting is easier. It's a challenge for either today or 5 years down the line. Why not try the talent today? I would say smoking cessation is a journey. Either it could be short-term or a long-term journey. Quit, relapse, but never stop trying. If you need help, come and contact us. That's the best thing we can do it for you. Stop smoking, start breathing. Thank you for listening.